Now friends, today I want to talk about something different. This is not going to be a technical discussion about risk management of medical devices, technical topics like probability or severity or risk acceptability. We talk about those too, but today I want to talk about something different. I want us to have an open mind today, take a step back from the busyness of day-to-day work, and let's just explore this question. The question, which I also posed to my LinkedIn followers in a poll recently, is this: would you still do risk management for your medical device if it was not expected or required by regulatory authorities? Well, hello everyone. I'm Naveen Agarwal and I'm so excited to be back with you. I welcome all of you to our weekly live discussions. If you are joining for the first time, we do this every week. And if you are returning, hello and welcome again. I see Greg, you have joined from Cleveland, Ohio. And again, guys, as you are joining, please share in the chat where you are joining from. Tell us a little bit about yourself and your role in the risk management process or the quality management system in your organization. So again, I'm Naveen Agarwal and again, so excited to welcome all of you. How many of you tuned into our conversation last week with Ed Bills? Share in the chat below what you thought about that. Did you learn anything new about the history and evolution of ISO 14971 as we discussed that with Ed? I know I did, and it was so insightful for me. I learned so many different things about how the thought process, the thinking behind ISO 14971 has evolved over time. It was very insightful to hear from him. So I hope you got a chance to tune into that. Let me know what you thought about that. And if you did not, well, I have actually written an article summarizing the key highlights of our discussion on my weekly newsletter. Now, many of you have already subscribed to my weekly newsletter on LinkedIn, but if you are not familiar with that, I write an article every week and post it on my weekly newsletter on LinkedIn. There's a link to subscribe to my newsletter on my profile section. You can go check it out and join close to 2,500 people now. We are sharing a lot of ideas, a lot of thoughts. I see Bijan and Tom. You have also joined. Again, thank you, Bijan and Tom. Greg, you are currently consulting in risk management for 30 plus years. Yes, great to have you here. Please continue to share your insights and questions in the chat. The more we talk with each other, the more we will learn from each other. So I was talking about our last week's discussion with Ed Bills. If you didn't get a chance to listen into that, the key highlights are on my newsletter. Now friends, today I want to talk about something different. This is not going to be a technical discussion about risk management of medical devices, technical topics like probability or severity or risk acceptability. We talk about those too, but today I want to talk about something different. I want us to have an open mind today, take a step back from the busyness of day-to-day work, and let's just explore this question. The question, which I also posed to my LinkedIn followers in a poll recently, is this: would you still do risk management for your medical device if it was not expected or required by regulatory authorities? I got some very interesting responses. I will share that with you in just a minute. But share in the chat your opinion. What do you think? Because I know in our industry, we do a lot of work for regulatory compliance. And sometimes that can be pretty exhausting, pretty burdensome. So I want us to keep an open mind and think about this. Okay, Steve, welcome. Again, you're joining, and a shout out to Martin and Paul. Thank you all for joining here. So guys, today I want us to have an open mind and be honest with each other. But let me remind you a couple of very, very quick key housekeeping points. This is an open forum, so please do not share any proprietary or business sensitive information. Let's be respectful to each other. We are not here to debate or argue. We are here to learn from each other. So in your comments, especially if you disagree with someone, let's express our disagreement and an alternate opinion in a respectful way. And finally, whatever we discuss today should not be taken as regulatory advice. Again, this is only for the purpose of information. So having said that, let me repeat the question again, because I know we do a lot of things in our industry for regulatory compliance, And I've seen at many clients in my practice, I have seen so much work going into risk management documentation, and causes a lot of confusion and anxiety and frustration at many times. So I'm sure you are probably in that situation as well, or you have seen that in your practice wherever you are working, whether in a company or as a consultant. I'm sure you have seen something like that. So the whole idea is to have an open mind today. Would we do something different if we did not have this burden of regulatory expectation or requirement? So let me quickly share with you a poll that I did on LinkedIn. And as I said before, I asked this question: would you still do risk management for your medical device if it was not expected or required by regulatory authorities? Let's see what people said. "95% of them said yes, we would still do risk management." And this is actually very good to hear, that we would want to do risk management regardless of whether it is required by regulatory authorities or not. 5% said no. Now, if you didn't get a chance to share your opinion in this poll, please share in the comments below what you think. Now, I didn't hear much from those who said no, but my feeling is this. My feeling is that they are saying no because they are looking at risk management or the practice of risk management as it is today. What they see around them about risk management, they are saying we would not want to do that if we didn't have a regulatory requirement. Tell me if you disagree with that. Bijan, you have a comment here. Yes, there are many benefits from risk management: product development, cost savings, legal liability issues, product quality. Yes, you are right. There are many reasons why we would want to do risk management, regardless of whether it is required or expected by regulatory authorities. But what is the truth here today? What's the truth? We worry about compliance a lot, and we create this documentation structure, which I have seen in practice, sometimes gives us a lot of problems. So I will share with you some of the very insightful comments that many people shared as part of this poll. But what do you guys think? What is your opinion? Bijan, you are expressing that yes, we would still do risk management. Would we do it in a different way? Would we do something different? I think that is what we want to explore today. What it is that we do today that is not working for us, that's giving us more frustration, more anxiety, and not really being effective in helping us meet our business objectives. And would we do things differently if we didn't have this burden? I think that is what we are trying to discuss and share with each other, what our thoughts are about that particular question. So can we imagine a world? Can we imagine a world where we were doing this for the right reasons? And I'm not implying that we are not doing that for the right reasons today, but it seems to me that an overwhelming reason or an overwhelming focus we have is on regulatory compliance. That's what it seems to me. Again, I would love to hear your thoughts. Tom, you have a comment here. I think a good follow-up is, could we keep the risk management effectiveness but improve efficiency of the work? Yes. Do the right things and do them right, right? Let's get the benefit of both. We are not probably being efficient in achieving our goals because a lot of the work that we have to do is burdensome. I'm an engineer by training, and the first time when I took on a quality role and started working with my peers in the R&D department, I was immediately confronted with this question: why are you making me fill this FMEA that has 500 lines and it's not very useful to me? Why are we spending our time on that? Have you found yourself in a situation like that? And as an engineer, I sympathize with them. I said, my response was, okay, what should we do different? Why are we doing it this way? Can we do something different? Can we start with a clean sheet of paper? For those of you who joined into Ed's conversation last week, Ed made this remark. Perhaps way back in 2000, we should have started with a clean sheet of paper. Perhaps he was thinking about that. Well, we are in 2022, and risk management has certainly become very, very important. We know EU MDR is out there. Everybody is thinking about risk management. But again, our focus seems to be regulatory compliance and meeting the regulatory requirements. Like I said, this is my personal observation, and I would love to hear from you if this is what you are experiencing in your role today. And what could we do different? Greg, you are sharing a comment here. I believe risk management is integral to the device development and is typically addressed during design effort. The requirements motivated developers to improve the practices and understand the importance of full life cycle risk management. Yes. The requirements are not really that burdensome, honestly speaking. Their implementation and execution seems to have become burdensome. And why do we find ourselves in that position today? What it is that is preventing us from efficiently deploying these requirements? They are good. We know their intent. We know why they are there. Ed actually shared many comments about that. So I agree with you, Greg. Yes, full life cycle approach, start in design, continue in post-market, and keep iterating to achieve a better place for safety and performance of our products. This is what we would love to do. Are we doing that? And what is stopping us from doing that? What in our risk management process is stopping us from doing that? Could we do something different? Paul, you are sharing a comment here. I believe that regulatory compliance is often the only justification used to explain or justify why risk management processes should be done. That does not help to establish a good quality focused culture. Paul, I think you hit the nerve. We seem to think that quality and risk management are two different things. Quality or safety, two different things. I don't think so. They're together. They're all part of the same equation. We seem to look at them differently because there are different regulatory requirements. So yes, much of our work and our decision making seems to be driven in the industry by what the requirements are and what will happen if we don't comply. Friends, let me tell you, there is no requirement to comply with ISO 14971. None of the regulatory bodies will tell you, you must comply with 14971. None. Tell me if I'm wrong. They would expect it because state of the art. This is what you should do. So let's not worry about compliance for a minute. Josh, thank you for sharing this comment here. You are saying, I believe that MDR and IVDR are adding to the burdensome aspects of risk management, but also the importance of this discussion. I partially agree with you, Josh, because MDR doesn't say use risk management in a certain way. They want us to do risk management. And we agree, we must do it. We agree, right? 95% of the people responding to my poll are saying we must do it. How we do it? MDR is not telling us how to do it. MDR is telling us do it. They have put it on paper. Now that's a big change. I agree. That's a big change. They have put it on paper. They want us to do it. We must do it. But how we do it is up to us. And what it is that we are doing that's creating such a big burden on us that we are really, in my opinion, my honest opinion, lost in the paperwork. So I invite you to share your comments. I really appreciate you guys sharing openly and freely. Now let me share with you some of the comments that our colleagues have shared in this poll with me on LinkedIn. Liz is sharing with us that she answered yes. It is an interesting question, what we might do differently in risk management if regulatory requirements were not so much a part of it. Maybe I have some embedded thinking, but I see them as very deeply intertwined and can't really think of major improvements to the standard itself. More guidance or what examples for different types of medical devices could be helpful. And this is absolutely true because we also heard from Ed last week. 2007, people said, by the time the 2007 work was being done, the process is good. Don't change the process requirements, but give us more guidance. And interestingly enough, when I asked Ed last week where he thought the current trajectory was for the standard, coming up in 2024 maybe, he said the same thing. He's hearing from people, tell us more about how to do it. So they provided guidance in annexes. They created a new ISO TR 24971 2020 revision, gave us a lot of guidance. But Ed also shared with us that many people took that as is and thought it was mandatory and started applying it. So a lot of confusion. So I think Liz is making a good point that as far as the requirements are concerned, We understand them. They're good. But we need more help. We need more help to do it right. That's a great point. Please share again. Continue to share in the chat what you guys think. Devin shared with us that yes, when properly implemented, consideration of risk is less burdensome and inherent to the culture of the organization. And I think that's the point, George, you were making, that if we don't look at regulatory compliance side of it, it should be part of the quality culture. Bijan, you are sharing here, I don't think ISO 14971 of EU MDR are designed to create a burden. Achieving their requirements is for our own good. We can achieve efficiencies by mindful and strategic application of their requirements, for example, by using automation. Absolutely. How we do it is up to us. What must be done, if we choose to do it that way, is described in ISO 14971. That is the state of the art. This is the reason why that's state of the art. For over 20 years, so much work has gone into that. But how we do it is up to us. I have one comment here. Let me scroll up a little bit. Daniel, you are joining from Minneapolis. Thank you for joining. Your opinion is that initially folks new to the industry are very mindful of making the product as safe as possible, but over time they get regulatory blinders that make them try and just make sure we meet all the minimal requirements needed to get the product out. So you see, our mindset also seems to be changing over time. We go in, we do our best work, we have a good product, we achieve market success. Now we start focusing on regulatory compliance because we don't want to get into trouble. So our mindset is focused on a different thing. But that's what I'm reading in this comment, and it's consistent with my experience as well. Okay, let me continue to share some of the other comments that I heard from colleagues. Kirsty is sharing that yes, she said yes, she would still do it. But with the ability to choose how I spend my time, I would be able to use the most appropriate activities to ensure effectiveness and safety. I would focus on better post-market and clinical data use. I would do it all in a Kanban type system, Jira, and traceability is inherent. I would use statistical reports rather than a 14971 risk management report. I would probably be more active in risk activity and more willing to experiment if I were not forced to comply with 14971. So a lot packed in there, but what I'm hearing here is this desire in all of us to do it right. And we have such great ideas to how to do it right. We seem to think that we have to comply with requirements in a certain way, otherwise we'll get in trouble with the regulatory authorities, and then we give up our freedom to choose the way we want to implement a process. What is right for us, keeping the patient in mind. So Kirsty is sharing with us a lot of, I would say, honest feelings, and this is what I encourage all of us to do in these comments. Please continue to share. Now let me go share another comment with you. Now this was, I'm biased in this area, so this was my favorite comment. Leanne is telling us, yes, it's good business sense, and I'm hearing that from a lot of you as well on the discussion today. Not incorporating risk management can lead to exorbitant costs and the obvious patient safety issues for a company in corrections and removals, not to mention the lawsuits if and when a device fails. So there are many good reasons to do it. It makes business sense. How we do it and how we are doing it seems to be landing us in a little bit of a problem. Tom, you are sharing more comments here. Automation may help to create the documents, but to keep them live, automation needs to incorporate how we use the risk analysis. Wow, this is so insightful. How we do risk analysis. Automation is coming later. It's coming after we have done the risk analysis, or we have set up to do risk analysis in the right way. And there are many, many challenges. In my practice, I found many, many practical challenges people have, not because they don't know how to do risk analysis. I think they do. They have very good engineers. They have very good quality people. They're just confused in the way the requirements are written and the guidance is provided. That's my guess. Ed, finally here. Thank you, Ed, for joining. I'm so glad you have joined again. Would love for you to contribute to this discussion. The question again, Ed, here is, what would we do different if we did not have a compliance kind of burden on our mind? I'm sensing a great desire in our community of practitioners to do risk management, whether it's required by risk management from a regulatory perspective or not, that is not the point. But I'm hearing from our colleagues that yes, we must do risk management, but we must do it for the right reasons, regardless of whether it is required by regulatory authorities or expected by regulatory authorities or not. So I'm very happy to hear that all of us want to do it. It seems to me that we are stuck in the way risk management is being practiced in the industry for one reason or another, that we are trying to get out of this quagmire, so as to say, that has been created over the years, so that we can focus on the right reasons to do risk management. Many business reasons. So please continue to share your thoughts, further suggestions. How would we change that? How would we get to that point? What is holding us back? What could we do differently? So would love to hear that from you in the comments as well. Okay, so while we are thinking about that, I want to pose another question to you. Before I go there, Ed, you are sharing, if we are truly interested in helping the patient, risk management is an important part of product development and support in the entire life cycle. Absolutely. But you say it right. If we are truly interested in helping the patient, risk management, if we are truly interested, and I believe we are, Ed, this is what I would share with you, is that I believe all of us, we are, because we work very hard in the industry. I have seen people work nights and weekends. I have seen them go beyond the expectation and do more because they are so committed to it. What I'm sensing is that we are not able to get out of the system that has been created. We are part of that system, and we are not able to fulfill this desire that we have in us to do it for the right reason, to do it for the patient. I know we want to. So I truly believe that in my heart. So let me continue with this question I was posing for you. What if safety became a business goal? Now let me say a little bit more about that, because of course safety is a business goal, right? Nobody wants to be unsafe. It is a business goal. Maybe it's an understood business goal, but not an explicit business goal. So let me share with you this kind of slightly off tangent idea. Now, I have young children who are in high school, and they actually had just gotten their driver's license. What is the first question that comes to a parent's mind when they start to think about their young child driving on the road? What is the first thought that comes to their mind? That they must have the safest possible car. They must have good habits, and hopefully we have helped them develop those good habits. But we worry about their safety. So colleagues, I want to ask you this question. This is completely off tangent. I want to ask you this question. Which brand of car comes to your mind when it comes to safety? Can you please share that in the chat? What comes to your mind first when you think of safety? Okay, before I go into that again, Ed, you are sharing, many are doing it to create documents for file and lose sight of the patient under pressure of time and business goals. Yes, that's a reality, Ed. Yes, that is the reality. That is the reality. We are running against the clock. We have to do so much work, and we have to do it right. Otherwise, there'll be a compliance problem. Okay, so Bijan, you are sharing Volvo, Vincent Volvo, Greg Volvo, Greg Mercedes. Yes, yes. Now, how do we hear about these names? Because they advertise, right? They advertise. And why do they advertise? Okay, Ed, you are saying Subaru. Why do they advertise? They advertise because they see business value in it. Do they measure return on investment in those advertising dollars? You bet they do. I'm sure they do. So Ed, you mentioned Subaru. All those answers are correct. And Subaru came to my mind. Okay. So here is Subaru's ad. Pushing safety technology forward is just one of the ways Subaru helps to keep you and your family safe. Now, Subaru does more than safety. Their whole mantra is love. Love. You buy a Subaru, you're going to love it. Now, I'm not a spokesperson for Subaru by no means. I have no relationship with them. There is no business relationship, no endorsement. But this is what I hear. And I'm sure you hear that too, right? It's love and safety. So how have they implemented that? I want to share that with you. And this is kind of a busy slide, but I just want us to pay. This came from their annual report. I want us to look at this line. We aim toward 0 fatal accidents in 2030. Top line. They have written it down. Is it a bold move? Yes. Do they think they can achieve it? Probably. Probably. Do they feel maybe intimidated by that? People at the working level, are they under pressure? Probably. But it is creating a conversation in their organization that they are able to report to shareholders, to the public. They're writing it down. We aim towards 0 fatal accidents in 2030. This is a busy slide, and I will post that in the notes for this session. And I'll talk about that a little bit more in my newsletter. They have a full map, and they have mapped their technologies and their efforts along those directions. Now, are they perfect? Probably not. Are they going to work all the time? Probably not. But what is the main point here? The main point is it is driving their organization to achieve this business goal. Are they worried about regulations? I'm sure they are. Automotive regulations are probably no less strict than medical device regulations. Maybe in some ways even more. Do they have a regulatory compliance burden? Yes, they do. So we are no different. Now, can we imagine a world where we hear these statements, these goals, not just vision, that we hear these statements reported to shareholders? Would we see real difference? Would we see real impact? Probably, hopefully. So I thought I'll close today's conversation with these few thoughts. Now, we went a little bit off tangent, I know, and we are almost out of time. But the whole point of conversation today was to really open our mind and challenge ourselves. Acknowledge the truth, be honest with each other, and take responsibility for changing it. This is where I'm committed. And this is where I know all of you are, because you show up every Tuesday to my live discussions. You engage with me in comments. You share your ideas and insights with me. I know you are. So let's do it together. Let's stay engaged, let's share information, and let's change it. Why not? I think we can. We have so many people with so much passion and commitment. I think we can. So with that, I look forward to hearing more from you. And before I go, I just want to share with you a few free resources that I offer to anybody who wants to connect with me. And you can find them on my website as well as on my LinkedIn profile. So there is a template I'm offering to people to do hazard analysis, and it will follow with video instructions on step-by-step how to do it, some best practices, and some mistakes to avoid. There's a knowledge sharing forum. Over 200 people have already joined. So please consider joining. And finally, you can schedule a one-to-one 30-minute, no strings attached conversation with me. I'm not trying to sell anything to you. I just want to make a connection with you. So I hope you all enjoyed today's conversation. Please continue your thoughts and comments coming. And I look forward to hearing from you and getting connected with you next week. Have a good week, everyone.